Do we know why these people got tested? I mean, 9 seems like just a weird number. I mean, were they showing symptoms or were they well, I guess, do we know why they got tested?
So based on the information I have, most of these individuals were symptomatic. So they would have gotten tested for symptoms. I'm not aware of them being linked to previous cases. So it's not that they were a previous contact of a case where we recommended them to be tested. It's my understanding is that these individuals were symptomatic and chose to get tested. So again, we're encouraging anyone with symptoms to stay home and get tested through an assessment center if you think it's a COVID-19, if COVID-19 is possible.
Thanks.
All right, thanks, Ryan. Troy Charles, and then we'll go to the phones. Last call for Troy Charles. Okay. I'm just going to go to the phones here really quickly. Excuse me. The callers 1, 2, 3, and okay. We have Logan Turner. Do you want to fire away, and then Myrna and Fort Francis?
Yeah, great. So thanks so much for unmuting. I was just curious, in the release that was sent out today about the travel advisory, it was specifically mentioned that sports teams were encouraged not to travel. I was just wondering if you could explain that specific inclusion. Like, have sports teams been thinking about traveling? Have they been traveling?
So there are a number of sports leagues that do travel to Winnipeg. So that was identified as a potential risk to us from a number of different perspectives. So that what I mean, it was one example that's used, but really it's just non-essential travel. We are encouraging members of the public to avoid non-essential travel outside of Northern Ontario, recognizing that we're seeing an increasing number of cases in Manitoba, particularly in the Winnipeg Regional Health area. And there are an increasing number of cases in Southern Ontario.
Okay, and then I just wanted to dive a little bit more, or know if you could dive a little bit more with me into the question around privacy and when institutions can be, like the names of institutions can be released, just because, like at what point, like how are you balancing privacy versus the importance of public health, of public knowledge?
That's right. So, Northwestern Health Unit, like many other healthcare organizations or health organizations, need to follow the Personal Health Information Protection Act. And that's particularly a requirement for medical officers of health. We are responsible for following that act. So we have used guidance from the Privacy Commission of Ontario to guide us on how best to release information to the public. Generally, we release case information over 4 regions, over our catchment area. And that's the reason of that, of course, is that people can't use that information along with the information released from the Ministry of Health, which includes things such as age and gender and so on. They don't combine that information and then try and identify the individuals that actually have COVID-19. However, there are situations where we feel like there's elevated risk. And so in which case we may choose to identify a community like a municipality. So in this situation, we are identifying that most of these cases are from the municipality of Kenora. Sorry, most of these cases live in the municipality of Kenora. Normally we would just say that there are a certain number of cases in the Kenora area. So that's how we're trying to find that balance between privacy and risk. We recognize it's important for people to be able to assess risk and to know when they need to be more concerned. And so that's why we would, in this particular situation, because we have an increasing number of cases in one particular community, we're identifying that. However, drilling it down to the school and to the actual institution, we would do so in an outbreak situation. None of these situations have been declared as an outbreak at this time. If it was declared as an outbreak, then we would state it as that it is. But at this time, none have been declared as an outbreak, and we are just assessing the situation to determine what needs to be done. So really, when you're talking about a small institution with a small number of children or attendees, then it becomes really easy to identify that individual. And so that's why we prefer not to identify the institution unless there's benefit of doing that.
Okay.
I hope that explains it. I mean, that's fairly long, but it's we are just trying to find that balance between providing information to the public to help them assess risk, but also respecting the privacy of a case.
Okay, if I could do just one more quick follow-up, just about the definition of outbreak, because I know it's a kind of a questionable one, and previously in long-term care homes, one case meant an outbreak. So how are you defining outbreak?
So outbreak is we receive definitions from the province. So generally, it's for a school, it's defined as 2 cases in a school where at least one case likely got infected with COVID-19 through the school setting. So at this point, because we're so early in the investigation, it's challenging to really know if that is the situation for any of the schools.
Okay, so Valley View could become, it could be declared an outbreak if those 2 cases are linked.
So if there's a
from
school
spread.
with 2 cases and at least one of them likely got infected through the school setting, then yes, that could be called as an outbreak. I think the word outbreak can often feel like a scary word for members of the public, and it needs to be recognized that we are using outbreak in a very technical way. 2 cases in a school does not necessarily mean that there's widespread transmission through a school. It could mean that there's transmission through a classroom. So we do try and assess the situation for each classroom to determine what needs to be done to reduce the spread of COVID-19.
All right, thank you, Logan. I'm going to ask if Myrna in Fort Frances has any questions. And here we go. She's quick on the draw. Is there more than one case at any specific school? If yes, does this count as an outbreak?
So do you want me to just answer that question again, John? I can if Myrna wants me to. Okay, I will.
Yeah, I think so, just for clarity.
Yeah. So there are 4 cases associated with schools, over 3 schools. So 4 cases associated with 3 schools. So 1 school does have 2 cases. At this point in the investigation, we're still trying to determine if transmission occurred during the school. And so that will help us to determine whether it should be declared as an outbreak or not.
And did you have a follow-up, Myrna, at all? No, all good. Okay, we'll move to the questions from Burley.Kenora on our chat function. There are 2 questions there, separated a little bit. What is the turnaround time for results at this point, and how does that impact contact tracing?
So questions related to turnaround times for testing should go towards the assessment center or to Ontario Health North, as they're the ones who manage the assessment centers or coordinate that work. And so they would best know what the turnaround times are.
Okay, and then their second question was, is the Wash Bay case included in the 9 cases in the Kenora area?
So our announcements and case numbers do include cases on First Nation communities.
Okay, thank you. And they've been answered. Tim Brody and then Sheena. Last call for Tim. And Sheena doesn't have any questions. Attic in progress was good. Oh, here we go from Tim. Any concern about the assessment centers being overwhelmed?
So definitely there will be an increased demand on assessment centers. So we are encouraging people to be patient and recognize that this is a new situation for everyone, and that they are, sorry, maybe I'll try saying that again. The 9 cases will mean that there's an increased demand on assessment centers. We are encouraging that people think carefully about whether they need to be tested, and really testing is recommended for anyone who has symptoms of COVID-19 and anyone who's been contacted by public health that they've been a contact of a case and should therefore be tested. People who are asymptomatic and have not had exposure to a COVID-19 case should not be tested in an assessment center.
Tim, did you have a follow-up?
Actually, maybe I should clarify that. So anyone who's asymptomatic and low risk and not been directed for testing but under a targeted testing campaign by the ministry should not require testing for COVID-19. So I just added an extra point there, Tim. I hope that's clear.
Okay, now I know we've got a couple more who have called in. Because of the system here on GoTo, it doesn't identify if you're with media or not. So I'm just going to open it. If you have called in, please feel free to jump in and ask your question if you have a question.
This is Carl Clutchy at the Chronicle Journal, Thunder Bay. Just recapping, I guess, just make sure I've got this straight. So out of the 9 new cases, most of which are in Kenora, 4 of the cases are in 3 schools and in Kenora. I'm just wondering if any of those 4 cases are students.
So for reasons of privacy, we avoid identifying too many details about the cases. As you can imagine, schools and school boards are expected to identify the actual institution. And then if you actually start drilling down on whether they're students or staff, it can become very easy to identify the individual. So we don't provide details on whether it's a staff or students. We do try and optimize the privacy for the cases. Having said that, we are assessing, of course, the risk in schools and looking closely to see what sort of interactions were occurring in schools to help guide our investigation.
All right, and then just finally, again, just recapping, so one of the 3 schools has 2 cases, but an outbreak has not been declared as yet, correct?
Yeah, at this point of the investigation, we need to determine if there's information to suggest that there's been transmission through the school, in which case it's declared as an outbreak.
Thank you.
Thanks, Carl. And we have one other on a phone line, and then I'm going to go to the submitted questions in the chat box and then wrap things up. Is there anyone else on the phone line? Okay, if not, then I'm going to just mute the phone lines again, and we'll go back to some submitted questions. Tim did have a follow-up. Any worry about the extra burden during cold and flu season?
So because of during the winter season, respiratory illnesses tend to increase. We are aware that therefore symptoms will increase, and therefore this could have an increased demand on assessment centers and our ability to follow up on cases. So we are encouraging everyone to get vaccinated for influenza, because that will increase the burden of disease, and therefore, we are encouraging everyone to get vaccinated for influenza, because that will reduce illness in the community and therefore reduce the impact on the healthcare sector and assessment centers.
All right. Is it possible to clarify how many tests are being provided by the province per month to the NWHU, and what the limiting factor at the moment is for testing turnaround times?
So Northwestern Health Unit does not control testing or the assessment centers. That work is primarily under the assessment centers themselves and the organizations that they're associated with, or with Ontario Health North. So those questions should be directed to them.
Okay. Troy had submitted concerns with how the numbers have risen over the past week, going from few to where they are now.
With 9 cases in one community over a period of, with 9 cases in one community, I think the people who live in Kenora and in the Kenora area need to be aware that they could be increased risk of COVID-19 and that they must be more diligent in following COVID-19 prevention measures. So that includes things such as physically distancing, avoiding touching your face, following good hand hygiene, wearing masks in enclosed public spaces, and staying home if you're sick and consider getting tested for COVID-19.
All right, well, thank you, Dr. Kit Young Hoon, for your time. I know you have to be out of here in another 4 minutes or so, so I think we'll wrap it up there. We managed to get through everyone, which is great. We got some follow-ups. Thank you to the media on short notice for joining us today and helping get the word out. And again, thank you, Dr. Young Hoon, for your time.
Thanks, everyone. Have a good weekend.